By By Design Optometry, and this is one of my staff members, Jenny.
Hi.
Since I've graduated in 2008, we spent a lot of training doing vision therapy training and post-concussion rehabilitation training. So we're going to talk a little bit about concussions and how they affect your visual system. Concussions are really prevalent, so actually 3.8 million concussions occur every single year. And once somebody has a concussion, they're actually 4 times more likely to receive a second concussion within the next 2 years. And all subsequent concussions are actually more common to occur from less severe injuries and can actually have a more significant impact on a patient's ability to function at school and work. So it is really important to properly take care of yourself after a concussion to ensure that you can properly recover from them.
So Sarah, can you tell us what a concussion is?
For sure. So a concussion is a type of a mild brain injury. Patients are often quite symptomatic after a concussion, and some patients, these symptoms can resolve relatively quickly, but other patients, these symptoms can be really persistent. In fact, 15% of patients who have a mild traumatic brain injury from a concussion can have symptoms that actually persist for a year or longer. Some of the damage can be immediate from the direct blow to the brain and can result in immediate symptoms. But other symptoms can actually occur at a later date due to altered metabolic activity in the brain.
Oh. And what are some common myths about concussions?
That's a great question. There's actually a lot of myths surrounding concussions. Probably the biggest one is that you have to be hit in the head to sustain a concussion. So this isn't true. Any force that's strong enough, so a blow to the body or also a blow to the head, if it's strong enough to actually kind of jostle the brain around in the skull or cause those shearing forces, they can cause injuries that can result in a concussion. Another common myth is that you have to lose consciousness to be diagnosed with a concussion. So this isn't true either. In fact, less than 10% of concussions actually result in loss of consciousness. The prognosis for recovery is a little bit worse if you do lose consciousness, so it is important for us to know if there was any sort of loss of consciousness after an event. Another thing that patients are often confused about is whether or not they have imaging in the brain and if that's going to show. So concussions don't always show on brain imaging, so you can have perfectly clear neuroimaging and still have signs of a concussion. Most patients also assume that you will experience symptoms immediately after a concussion. And as I mentioned before, this is not always the case. So some symptoms can actually occur anytime within the next 7 to 10 days following a concussion. One thing that patients also are unsure about is whether or not you should allow a patient to sleep following a concussion. So I think it was previously thought that you shouldn't allow a patient who's concussed to sleep and that you should wake them up every hour. This in fact is not true, and it can actually delay recovery from a concussion as well. So you should let a concussion patient sleep as much or as little as they feel necessary. It's like recovering from any other injury or illness. Your body does need to rest to properly recover from that. Another common myth is that a sports concussion is different than a regular concussion. So your brain doesn't know how it sustained a concussion, so a concussion is a concussion. One thing that may be different about a sports concussion, though, is that in a concussion sustained from a typical injury, patients often don't experience another injury. So they're injured and they don't get into another car accident, for instance, whereas a concussion sustained from sports, if they're not removed from play, then they could sustain additional injuries if the concussion is not properly assessed.
And what are some modifications that can be recommended in the early stages of a concussion?
Modifications are really important in the first 24 to 48 hours. So we usually recommend cognitive rest. So this is avoiding any sort of activities such as reading, cell phone use, texting, that sort of thing, to give your brain a rest. And then physical rest as well. Physical rest doesn't necessarily have to mean complete bed rest, though. You just want to avoid physical activities that cause symptoms. And we do, in fact, encourage working up to additional physical activity after that initial 24 to 48 hour rest period. For visual concerns, when patients are symptomatic, some accommodations that we make are doing things like enlarging font can be really helpful. taking shorter reading breaks, so reading for only 5 to 10 minutes at a time. You can also limit digital devices, so they can be really symptom provoking for patients, and decrease the brightness on cell phones if you do have to use them.
And how do concussions affect vision?
Visual symptoms after a concussion are actually really common. There's a lot of visual connections in the brain. There's actually over 300 neural connections in the brain that have to do with the visual system, and 32 centers in the brain that have to do with vision as well. So because the brain is, vision is so ingrained in all other brain functioning, it's very common to have some sort of visual issue after a concussion.
And what sort of symptoms could I experience after I have a concussion?
So visual symptoms after a concussion can be anything from dry eye to eye strain, headaches associated with near work. Some patients can experience double vision. You can experience balance issues that are actually visual in nature. Patients can also have hypersensitivity to motion in their periphery. They can experience dizziness or nausea. There's significant symptoms that can be visual in origin following a concussion.
What should I do if I experience these symptoms?
If patients are still experiencing symptoms and it's been over 1 to 3 months following the episode that caused the concussion, I would suggest they seek out an evaluation with an optometrist that has training in neuro-rehabilitation. The assessment that we do on patients is a little bit different than a routine eye exam. So we do go through and check the health of the eyes and make sure that there wasn't any damage to the visual system. We also go through and check a number of different visual efficiencies. So we check your eye teaming and your eye tracking and your ability to focus your eyes. And then we can do additional testing to check for things like motion sensitivity or balance issues and stuff like that as well.
And what treatments are available if vision issues are found, Sarah?
So if we do find vision issues, the treatments can sometimes be as simple as prescribing patients different tints that can affect their visual processing. Sometimes this has an immediate effect on reducing symptoms. We can prescribe special prisms called yolk prisms that can again have an immediate effect on a patient's balance if they're having issues there. Some patients do require neuro-optometric rehabilitation, which is basically a vision therapy program where we do various visual activities with the patient and incorporate them into other activities to improve the efficiency of their visual system and help to eliminate visual issues. And oftentimes, if we can eliminate the visual effects of a concussion, it can actually make the progress through other rehabilitation programs much more successful.
And do you work with other professionals if I'm in some kind of rehabilitation program?
We do. In fact, it's really important to have collaborative care with other professionals. So if patients are undergoing certain rehabilitation programs with physiotherapists or psychologists or occupational therapists, it is really important to us to collaborate our care to ensure the most success with other programs for patients. We actually, as I mentioned before, we do find that patients can sometimes achieve better success in these programs if they're also simultaneously receiving the vision training while undergoing these other treatment programs, because the visual system takes in so much information about the world, it can actually impair their success in some of their other treatment programs if it's not effectively treated.
And what do I do if my symptoms are too severe to do vision therapy?
Oftentimes patients with the most severe symptoms are the ones that actually require vision therapy the most. So we can always modify activities to make them achievable for patients. So we have a number of accommodations that we can do when we start off within the patient's realm of ability to make sure that they can do them, and then we just progressively make them harder and harder until they can do them more automatic. Yeah.
Thanks, Sarah.
You're welcome. So thank you for tuning in again. I'm Dr. Sarah Keep from Vision by Design Optometry, and this is Jenny. So thanks again for joining us.
Thanks, guys.
We hope that you found this information on concussion and post-concussion rehabilitation informative, and if you have, feel free to like our channel and find out more. We'll post some more interesting videos about eye health and eye care.